SPECT MPI, or Single Photon Emission Computed Tomography Myocardial Perfusion Imaging, is a powerful diagnostic tool used to evaluate blood flow to the heart muscle, diagnose coronary artery disease, and assess myocardial viability. In this video, we'll explore the diagnostic mechanism of SPECT MPI, covering how radiotracers are used, the process of image acquisition, and how these images are interpreted to guide treatment decisions. SPECT MPI begins with the administration of a radiotracer, such as technetium-99m or thallium-201. These substances are injected into the bloodstream and have unique properties that allow them to be absorbed by the heart muscle in proportion to the blood flow. After injection, the radiotracer circulates through the blood and is taken up by myocardial cells. Areas with good blood flow absorb more of the radiotracer, while areas with reduced blood flow absorb less. The test involves imaging during two different states, stress and rest. Stress can be induced by exercise, like walking on a treadmill, or pharmacologically using agents like adenosine or dobutamine for those unable to exercise. After the stress phase, the heart returns to its resting state, and imaging is performed again. This allows for comparison between the heart's blood flow during activity and at rest. Once the radiotracer is taken up by the heart, a gamma camera is used to capture images. This camera detects gamma rays emitted by the radiotracer as it decays and captures these emissions from multiple angles around the patient's chest. The data collected by the gamma camera is processed to create a series of 2D images, which are then reconstructed into 3D images of the heart. These images visually represent the blood flow distribution within the myocardium. The heart's perfusion is compared between the stress and rest phases. Areas with reduced radiotracer uptake during stress, but normal uptake at rest suggest reversible ischemia, indicating potentially treatable coronary artery disease. If an area shows reduced uptake during both stress and rest, this indicates a fixed perfusion defect, often corresponding to scar tissue from a previous heart attack, where the tissue is no longer viable. Areas with normal radiotracer uptake during both phases indicate normal blood flow, suggesting a low likelihood of significant coronary artery disease. SPECT MPI can also assess the heart's pumping function, known as ejection fraction, and the movement of the heart walls, known as wall motion. This helps in evaluating the overall function of the left ventricle. Quantitative analysis involves calculating perfusion scores, which provide an objective measure of the extent and severity of ischemia. The primary outcome of SPECT MPI is identifying areas of myocardial ischemia, which may indicate obstructive coronary artery disease. The extent and severity of perfusion defects help assess the patient's risk of future cardiac events, such as a heart attack or cardiac death. The results from SPECT MPI guide clinical decisions, including the need for further diagnostic tests like coronary angiography, medical management, or revascularization procedures like angioplasty or bypass surgery. SPECT MPI provides a detailed view of myocardial perfusion, helping clinicians diagnose coronary artery disease, assess ischemia, and evaluate heart muscle viability. Understanding how SPECT MPI works is crucial for making informed treatment decisions. Thank you for watching. Always consult with your healthcare provider to determine if SPECT MPI is appropriate for your condition.